All right, Dr. Feldman. So, what should our audiences know about acne and what causes acne?
Well, acne is not a contagious condition. It evolves in the follicles of the face. The face is covered with little openings that allow oil to come out. In acne, those openings are blocked, the oil accumulates, bacteria act on that oil, and then inflammation occurs.
All right. And is there a way a person can decide or a doctor can decide how severe the acne is?
Yes, I like to categorize acne as either mild or severe, and a lot of it depends on how much it's bothering the person. But if it's causing scars, then it's severe.
Okay, and what are the treatment options available for somebody with acne in today's medicine?
Sure. Well, the first step of treatment is not to make things worse. So you shouldn't pick at the spots. You can cause more scarring, spread infection around if you pick at your acne spots. The second treatment would be an over-the-counter remedy. You could use benzoyl peroxide over the counter. It's one of the active ingredients in Proactive, so you don't have to spend a lot of money on it. You can just buy plain benzoyl peroxide in the store, and that's a very effective approach. One of the foundations of treating acne, if the over-the-counter products doesn't work, is to see a family doctor or dermatologist. Get started on one of the topical retinoids, like topical adapalene or tretinoin. Brand names for these might be Differin and Retin-A. These help eliminate the blockages that are the fundamental start of the acne problem. For those patients who have worse acne, the use of the tretinoin with a benzoyl peroxide is a good combination, but that's complicated. Especially for teenagers, it's hard to remember to do one thing, much less two. They now make products like Epiduo that contain both a retinoid and benzoyl peroxide together. Using the medicine well is a critical issue, and it's important to let your doctor know how well you're using it. So if you're not doing it every day, that's okay, but let your doctor know so they can plan accordingly. For people who don't get control with just the topicals alone, we use oral antibiotics as the next step. There are a number that are safe and very effective for acne. Taking them for a couple weeks or months is probably the best way to use them, and then using the topicals to keep control of the disease after that. Now, if you're a woman, birth control pills will suppress natural hormone levels that cause acne. Those hormones make the oil glands overactive, and that's a great way to treat acne. For the patients who have severe disease where it's scarring and these other treatments, these more conservative approaches haven't worked, isotretinoin is a terrific drug. It's a relative of vitamin A. It has a number of annoying side effects like headaches, hair loss, depression, dry eyes, trouble seeing in the dark, dry nose, nosebleeds, dry mouth, dry skin, achy joints, nail changes. Red Cross wouldn't want your blood while you're on it, elevation of blood, liver enzymes, blood fat levels, and you absolutely, positively must not become pregnant on it because it causes severe birth defects. But other than that, it's really quite safe. And taking it for 5 months can result in a permanent cure in acne.
Permanent cure?
Permanent cure.
Oh, perfect. And is there a way, suppose, for those people who have developed acne and they have developed scars subsequent to the acne, is there a way to address those scars or pigmentation?
Absolutely. A lot of the appearance of a scar will be due to redness, and the redness is blood flow healing the tissue, and that will naturally go away on its own, as will some of the dark color, although that can take time. For more severe scars, yes, you can see a physician who can sand the skin down in a medically controlled way. Either the old way was with, a form of sandpaper. Nowadays, maybe with a laser to smooth out some of the changes in the surface of the skin. Exactly.
So no more sandpapers. And just to go back on the initial treatment, initial line of treatment, which is benzoyl peroxide and Retin-A. So if I remember, so you take benzoyl peroxide usually in the morning time, or how am I saying it incorrectly?
Sure. Yes, with some of the retinoids like tretinoin, they're not compatible with benzoyl peroxide. The benzoyl peroxide works by killing bacteria by oxidizing them, but it can oxidize tretinoin as well. So we would have people use benzoyl peroxide in the morning and the tretinoin at night. Also, the tretinoin might be inactivated by sun, so better to use it at night. But if you're using adapalene, it's compatible with the benzoyl peroxide,
Oh,
and that's
okay.
why the combination product Epiduo is so convenient.
And they don't have to worry about photosensitivity of the retin-A?
Tretinoin and retin-A can make your face more sensitive to the sun. You know, we dermatologists like to see people wearing big hats to protect themselves from the sun anyway.
All right, sounds good. Thank you so much, Dr. Feldman, for acne talk.
My pleasure.
Thank you. So,
Perfect.
we cut it.